And welcome back. And we're moving into our second segment for today as we're joined by representatives of the Ministry of Health, specifically from Western Regional Hospital. We have with us on set Deputy Regional Health Manager Desiree Mejia. We have Chief of Staff at the Western Regional Hospital, Dr. Rene Godoy, and we have the Regional Health Manager, Melinda Guerra. Good morning and welcome, and thank you for being here.
Thank you for inviting us.
Good morning.
So let's start off by talking about the Western Regional Hospital and specifically the services that are offered there and who it caters to.
Okay. Good morning, everybody, again. And yes, we are here representing the Western Regional Hospital, Ministry of Health. The Western Regional Hospital, according to the last census, 2010, we have like a total of 75,000 persons living in our area. At the Western Regional Hospital, we have two major hospitals, which is the Western Regional Hospital and the San Ignacio Community Hospital. We also have 5 health posts. One is in Benqueview del Carmen, Mopan Clinic, Georgeville Health Center, then coming up, Valley of Peace. We also have the San Ignacio Health Center, which is at the San Ignacio Community Hospital, and the Western Regional Health Center, which is in the Balopan Hospital. We also have some health posts. These are situated throughout the different villages. We have a number of them. And the services that we offer are the secondary care. We have the basic specialties. We have obstetrics, obstetricians there, pediatrics, surgery, and internal medicine. We also have psychiatrists services that we provide, and at the primary care we have a dentist. Those are for the secondary care. At the primary care, which I mentioned before, we have the again to reiterate, we have the dentist. We also offer all the attend to the outpatient basis, to the outpatients with our medical officers. And we have also a number of programs, such as we have HECOPAM, maternal and child health. We have environmental health that serves the different communities that we have.
And the number of persons who would access healthcare through the Western region? Approximate?
Well, we have on an annual basis. Our statistics show that for the outpatient department, total for the Western Regional, we had like a total of 60,000, just coming on a day-to-day basis for the year. And every year we see how the trend is increasing because the population is getting bigger.
Right, absolutely. Yeah. Now, I think let's talk about some of the things that you have been working on implementing this year. You have been participating in some quality improvement initiatives. Now, we have to start off, of course, because the Western Regional has gotten some bad coverage over the years because of challenges that you faced. And it spanned, I think, the most popular one or the most well-known one is, of course, the rat problem that you guys faced. Let's talk about what you have done since these issues to be able to ensure better health care within the Western Regional.
Okay, no problem. I could just mention that, we have, like any institution, we face challenges, but our main focus is one of moving forward, one of strengthening the quality of services that we have, like how you rightly mentioned. And probably Ms. Mejia, you can mention the initiatives that we are having.
Well, the main initiative that the Western Health Region undertook this year was the quality improvement committees that we have within the health facilities. And this committee, monitors and supervises across all service areas. So there is continuous monitoring and supervision, like I said, across service areas. And in terms of the monitoring, we're able to pick up our gaps. And then in identifying our gaps, we work on plans on how to improve those within a month's time. And then we put our gaps in terms of medium term, long term, and the available resources that we might have at that time. And so most of the focus, or one of the strengths of this committee, is that we do a lot of trainings. And we train our staff because those are the first person or the first contact within the health system. And with the quality improvement committees also, we're able to monitor our successes because we have tangible figures that we're working with, percentages, numbers, so we can actually see how we progress, how we start off, what we call the baseline, and how we progress over the years. And the recent one that we had was the evaluation from the Ministry of Health in terms of the licensing and accreditation unit, whereby both facilities in terms of San Ignacio and Western Regional made improvements this year. It's not significant, but it's significant to us because of the work that we put in to these activities on a daily basis.
I just want to add that actually we did make a huge strides, because we were compared to the rest of the other regional hospitals. And even though the results have not been issued out, but we have scored as the #1 hospital when it comes to scoring in quality initiatives within the Ministry of Health. Yes.
So you've obviously put these initiatives in place, and I think providers of healthcare are ultimately people. You're going to serve the regular person who comes in for whatever reason. How do you work with your staff to be able to meet the needs of the people from the region who come into the different clinics or hospitals?
I, being one of the latest members to come on board, in the capacity of a general surgeon, I used to criticize the administration of, for every 10 meetings they have, 9 of them is to evaluate the first one that happened.
I love your honesty. That's true, right?
So, but the Western Regional has had so unique challenges that just stepping and looking from the outside in and not doing anything was not an option. And that's the reason why now the focus of these quality improvement initiatives, we are going to work together, we are going to work as partners, we are going to work with other stakeholders. Just don't stand outside and criticize. What do you have to offer so that we can improve the quality of services that we do?
Well, how important was feedback from the actual users of the hospital to be incorporated in the quality evaluation and monitoring? How important was their input?
Well, maybe I should backtrack, because part of the quality initiative too is the complaint policy. And it's not as advertised as we would like, because we still see persons going to social media to make a complaint versus using this policy that we have in place from 2009. And through that mediums, yes, thank you, we pick up a lot of PR issues, and then we try to cater trainings around that, because we try to do 2 PR trainings with our staff for the year.
Now,
sorry, I just wanted to add, when it comes to quality initiative, how the momentum in the region right now is that we want to let the staff know, and we are sharing this with the staff, is that it has to be a personal initiative. Quality starts with you, the individual, with us, the providers, and also with the clients who are coming to our facility, because the clients need to make sure that that they are accessing quality service that is safe services, and that we can can utilize those services, but it has to start with us, the providers. And like mentioned earlier, we ensure then that there is the monitoring right then there every day. That's the big change. Instead of us monitoring at the end of the month, yes, we have our monthly meetings, but quality is something that is measured every minute, every hour. We have to make sure that if it's during the day or during the night, that our officers, that our healthcare providers are providing the optimum care that the patient deserves. If it is not done according to the standard, then there's where, like Ms. Mejia mentioned, we have our complaint form, where the officer have the right to make a complaint. We also have the patient's bill of rights, that we want to sensitize the patient more and more. What is their rights? You have a right to come to the hospital and bring your family member and bring a relative. Of course, within, with respect to other patients. But that's the kind of dialogue we want the community to know out there. You can come. We are being more friendly at the hospital, improve public relations, and that's the direction that the hospital is going. Once we start offering service in that manner and the person receptive, then change will come.
So you've initiated this quality improvement program, and I want to ask because it's like customer care, but when it comes to healthcare, it's extremely delicate. Because one, you're dealing with life and death situations. Two, you're dealing with people, relatives of the person who's ill, who are emotionally distressed. I always tell people, if my baby has a cough and you have a gunshot, sometimes the family members are as distressed, no matter the severity. The triage doesn't, it's not something we take into consideration. But most importantly, when something goes wrong in a hospital, it is obviously a huge issue, and people, as you pointed out, go to social media. People find ways to be able to vent out their frustrations with the experience they've had. But Desiree, you spoke about the successes. Now, the loss of one life through wrong procedure or improper care, I think we can all agree is unacceptable. But how do you ensure that you are promoting the services that are offered, the quality care that you do provide, and still be able to address the concerns of those who go out to social media and other forms complaining about the service they get?
Well, when it comes to the social media aspect, somebody always sees it. And we tried, even though it's not a formal complaint, we try to get in contact with those persons to address whatever issues they may have had at that encounter, at that particular encounter at the hospital.
Let me jump in there. What's the most common complaint that you would get, that you find yourself responding to?
What it would be the attitude of the healthcare workers. Those are one of the most common complaints. And the one that you touched on earlier, the issue of what is urgent versus non-urgent and which one takes priority.
The triage situation, which we know KHMH battles here too at their emergency room. So how do you overcome that? First of all, the staff interaction is absolutely important. And in situations where it could be resources, or it could just be simply someone doesn't have the right customer service attitude to be able to approach people. How do you deal with that?
We have been implementing our changes that are attached to quality improvement initiatives. And these involve continuous medical education with our staff, sensitizing them that from moving forward is the patient is the center of our attention. Without that, we basically don't exist. And that communication with your patient, that communication that you have to dedicate, if you do not dedicate time to explain to your patient on what is going on, you will dedicate time to explaining the complications that you will further see down the line. So it's a preventative, being proactive, and it has a lot. Our triage is going to be revamped. It's being the obstetric triage is one of our golden standards right now that we are trying to implement. We are going to implement at the Western Regional. And it takes a lot of continuous medical education, sensitization.
Dr. Godoy, I know that you're mentioning continuous medical education, and I'm not sure, and you could probably answer this for me, I'm not sure what the national standard is as it relates to licensing and ensuring that the doctors who work at the Western Regional are always up to par and new medical techniques, new medical practices. How do you ensure that the doctors are being proactive about making sure that they are as equipped and capacitated as possible to serve the patients?
From the moment you take an oath, you know that your responsibility is, and you will be held against a higher standard than anyone else. It is your responsibility, it is your initiative to keep, because medicine changes every day, and it changes dramatically sometimes. But to give you a critical point on that, the Belize Medical Council will not issue licenses now if you don't have credits. Where you have to demonstrate that you have been in the process of continuous medical education, so that you can be licensed as a physician to practice medicine in Belize.
That's great. And I think that would ease some of the concerns, because I know that a lot of persons, they go to a doctor and they recommend to a friend, and they'd say, no, I'm not going to the doctor because he the wrong since Jesus me born, and he don't know nothing about new medical practices. So I know that's a concern that a lot of people have.
Or he's too young.
Or
and
that one.
He has a baby
Or
face.
that
He look like the milk not dry by his mouth yet. And with the practice medicine.
Very
I'm sure you've heard it all. I think I want to go back to the quality assurance once again, looking at the experience. If someone is to enter Western Regional with whatever health complication they have today, tomorrow, what would be distinctly different if they had been there a year before? What's different now about the service, the care, the interaction? What can they expect?
Well, throughout the region, I would say, in our hospitals right now, but specifically Western Regional Hospital, one of the main things and the results that we are seeing, we had results before where we were probably 30%, 40%, let's say in public relations. Now, more and more, we are making the staff aware, when you come here, when persons come to the hospital, when our patients come to or visitors come to the hospital, we have to be so sensitive to their needs, not to our needs. They come first. And so it's something, culture is something difficult to change. It takes time, behavior takes time, but that's the change that we are bringing on board, making sure that we are receptive to the client. And that the doctor can introduce himself. As part of the tool that we have is that I have to say, hi, I am Ms. Guerra, I am Nurse Guerra. I am Dr. Godoy. I'm going to be your doctor today. So I think that's the first touch. Then, secondly to that, we have to make sure that we have the equipment and that it is working. Even though it's the basic equipment that we have, it's secondary service that we provide, that it is functional and that it is available in the doctor's cubicles, where the treatment is provided. We have to make sure that privacy is provided for the patient, and especially confidentiality. So these are the main things that we are working on. It is work in progress, we are monitoring, and that's the important thing about quality, is that we monitor exactly like how you said, Marlene, from the time the patient enters the hospital till the time the patient comes out of the hospital. And for that, we have a monitoring tool now. We have the patient satisfaction survey that we are applying. The results are not so good at this point in time, but like I mentioned before, we are working with the staff, and it's also demanding from the staff, because all of us are getting a salary, which we are being paid from the public's monies. So we are saying, okay, you know what? You are getting a salary here, you are being paid. We are doing ongoing evaluations, which usually is reflected at the end of the 6 months where we do an appraisal. And then there's where we are going to say, you see, X, Y, Z happened, and what was the reason why you did well or why you did not do well to our staff. But we need the feedback from the patients, from the relatives. We welcome complaints, and we also welcome, good suggestions as to what we are doing. I know there are a lot of there are Facebook, different avenues, where they can put their concern. But those are the improvements that we have. We want to start at the entrance, and like how Dr. Godoy mentioned,
the full experience.
Yes, we. Like how Dr. Godoy mentioned a while ago, we are going to have the obstetric triage, and this is going to completely change how patients enter the health facility. We still have not implemented because it's in the designing phase. We are working on our tools right now, the checklist, flow charts, and I think by January we are supposed to implement. Yes.
Well, interesting. At the ministry level, what are, in terms of interacting with your colleagues and the needs of the hospital, what are some of the challenges that you have faced and that you are actively tackling at this moment?
Well, one of the challenges would be the growing population and the amount of human resources that is actually available within the facilities, which hence lead to the complaint of the long waiting hours. But in terms of, if we link the long waiting hours in terms of providing quality, then I guess it's something that needs to be balanced off, because if we're going to offer quality, then it means it's going to take time. I won't walk into the consultation room and the patient is going to be there 5 minutes and I'm offering quality. So if they come in and I say, if I'm supposed to be thorough and do a thorough examination in terms of questions that I ask to actually come up with a diagnosis, then that's going to take time. Right. We're looking, I think the literature says 20 minutes per patient. But when you're out there waiting, you don't understand that the person in there is getting thoroughly evaluated, so then you complain, well, how they take so long? No, that turned out to see me. You know, but it's the whole concept of the quality that we're trying to offer.
It is true in terms of growing population, and what I wanted to touch on very importantly is looking at the type of illnesses and injuries that you're now dealing with within your particular region. Primarily, I want to say, we've been seeing an increased number of crime taking place in San Ignacio, which means you have stab wounds, you have gunshot victims, and in speaking with KHMH, we know that that's a very heavy burden on A&E, the accident and emergency here. Blood supplies, having people on hand, enough beds in the emergency room. So I imagine that the dynamics has changed quite a bit. Let's talk about what are some of the illnesses that you have been dealing with within the hospitals itself there. And of course you have Western Regional and you have the,
Well, we divide the communicable and non-communicable diseases, and we are just at the same level with the rest of the country when you come to heart problems, hypertension, diabetes, etc. And your communicable diseases that already gastroenteritis, flu, etc. But crime is something that, and accidents, traffic accidents, especially on the George Price Highway, when the initiative was for safer road safety project, I think attached to that was safer and responsible drivers. Yeah. Because you can have a spanking highway, but if your drivers are not responsible, we have an issue. Mm-hmm. But to your point, this triaging that we're doing, this implementation on our tools and how we are going to move forward will help us address on a very timely manner how this quality of service that we are going to offer to our clients.
And how have you been able to meet the emerging needs when it comes to critical care in emergency?
We have been, the restructuring of our hospital entails on the responsibility falls on the services that we are providing. And we are trying to work with our partners in the south because we cover them every other weekend or every other day. And as well as our referrals from San Ignacio. And what we are telling them is we want to speak one voice, we want to work together. We want to make sure that we do not have to send that enormous amount of referrals to Carl Huchner because they have their challenges by themselves. So what we can resolve at our level, we want to do that first and foremost before we have to move on to the tertiary level.
Just to add, also to add to that is that, we are working with a safety project. We have a protocol that we are, that we work in collaboration with them. Actually, we had the ambulance. We have a new ambulance that we received through that project that supports the Western Regional Hospital. We are also working with the police department, especially when we do blood drives. They have assisted us because, like mentioned earlier, there is a great need, for blood donors. At the Western Regional, also we have expanded the hours for persons to come to donate, make blood donations. So that's something. We go out into the community every so often, we go out and have blood drives too. So these are the initiatives that we are doing, to try to address some of the need for blood.
And going back to some of the conditions that we're seeing within the region, we also know that because of how the urbanization is taking place within the western portion of the country, that you are also seeing some of the mosquito-borne illnesses a lot more than other parts of the country. So we know dengue is usually something that plagues that region. We have the introduction of Zika now that, of course, people are very fearful about. Let's talk about what seems to be more prevalent and cyclical within your own region.
Okay, when it comes to our vector control program, it's a very strong program. It's being managed by the public health inspector along with Mr. Kim Bautista from the headquarters, Ministry of Health. And we are working with the different village councils, with the town councils, and with city councils. We are also working with different community groups, for example, in Cotton Tree, Armenia, we have in Benqueviejo, we do work with the persons there. And what we do with the control program is that we still have that's a program ongoing where we have the thermal fogging, educating people. But especially when it comes to the high-risk areas, especially with Zika right now, we have to make sure we do targeted interventions. So we keep an active surveillance of any case, especially if it's pregnant women. So we have to make sure that we follow them up, that we go in and spray their homes, give them the health education. We have the mosquito nets that we are giving them. Pregnant women also get the repellent, so, and this is throughout the Coyote district and throughout the country. The numbers, once we have a case, we follow up the mother, especially if it's a pregnant mother, up to the time of delivery, and the baby is monitored by the public health nurses. So it's an ongoing strategy that we have right now, it's strong. Also, currently as we speak, the Ministry of Health is conducting a project where they are testing for types of mosquitoes circulating in Belize. I think probably you have heard about that through Mr. Kim Bautista, and it's going to be taken to Mexico for testing to determine the type of mosquitoes and if any resistance to the insecticide. Because I know persons out there are concerned about the spraying that we do, especially with the ULV machine. So at the end of the day, we hope to have these results and share with them. But at the Western Regional, we have seen a decline in the number of, let's say, dengue, chikungunya, cases.
And the number of Zika cases you've confirmed?
I think we had like 20-something cases confirmed, 23 cases confirmed cases. And out of them, we had like 12, I think, pregnant women that we had.
And you've started active monitoring for up until delivery and after delivery, right?
Exactly. Because we have to make sure, that the baby is monitored, especially for the microcephaly, the small little head, or to make sure that anybody else, especially the adults too, for any like paralysis, like polio, when you cannot walk. So we monitor for those at the hospital.
And the Ministry of Health, through the auspices of Dr. Beard, has just provided a training to medical officers and specialists with ultrasound, so that they can detect earlier, so that we are in the capacity of having that diagnosis far earlier than what is right now available.
I'm glad you mentioned that, because going back to what Marlene was talking about, the dynamics of health issues in our country and the region, it's always evolving, always changing. What are some of the innovative initiatives that that the Western Regional Hospital is trying to implement? In terms of, I know that our producer told us that you have the mobile clinic and the capacitation of doctors, the continuous capacitation, but what are some of the other innovations?
We are working in collaboration with visiting medical teams right now from the United States. And they have been, we are at the planning stage of it. We are just meeting and greeting them and finding out what are our challenges, what resources we don't have, so that they can complement it with what we have at the Western Regional. Not bringing a first world answer to a third world problem. Right. So if it doesn't fit, then it's no use to us. So we're working on that, and that's one of the aspects that we're trying to improve at the Western Regional.
Yes, and we just want to work. We are working in line with our mission and vision, which is to build partnerships at the end of the day for a healthy population. So this is one of the ways that we are doing it. Where we bring these medical missions actually in August. I think August. We are going to have a team here. We are going to be an orthopedic doctor.
Orthopedic doctor.
And then we are already, in consultation with our CEO, Dr. Figueroa, and our DHS. We are planning to see, how if it's going to come to our reality, to offer these services to our community. So we do have those. Other achievements that we have had in the region is that we have equipment. Equipment is always a challenge, But if we have one additional ultrasound machine, that's a big difference for the population. They don't have to go and pay, and especially if our doctors are trained, it makes a difference. We want to sustain also the gains that we have had. We have our immunization programs. I know we had the HPV vaccine. You know, it is a little, still, I know there's a bit of reluctance within the community, but with this vaccine, what we are doing is ensuring, that we protect our young girls.
Yeah, that's right.
So we still have to do more health education on that.
Yeah.
We have mentioned earlier the vector control program again, strong program.
There's
going.
also the flu shot that is administered this time, right?
Yes, around this time. We have our very important. We have to continue working with our community health workers and our traditional birth attendants who are the backbone out there in the community, who keep feeding, us with information as to what is happening in the communities. Yes.
All right. Well, we're so grateful that you stopped in to tell us a bit of what you've been up to over the course of the year. And, I think we have to be very honest with ourselves that where there will be challenges within the system, what we're hearing from you is that you're working on fixing them. And Desiree, I want to be able to give you the opportunity, because you spoke about it earlier, that a part of being able to improve services is being able to document challenges that people have. And you'd prefer them to do it through the proper courses. So let's talk once again about what people can do about sharing their experience with Western Regional.
Okay, well, within all the facilities, there are complaint boxes within all the service areas, pencils, paper, but in absent that you don't see it, you can access the forms at the front desk. And I think at Western Regional Hospital, they have phone lines.
Okay.
So you can actually pick up the phone, dial number, and get the administrator to lodge your complaint.
Okay. All right. Well, thank you so much for stopping in today. We appreciate it, and best of luck.
Thank you.
Merry Christmas.
We're going to go ahead and take a break, and when we come back, we'll be getting all the details of the annual Christmas concert being held by the Pelote School of Music. So stay tuned.